Good afternoon, North Dakota. Again, I want to thank all of the folks who are listening in today live or who are watching on replay. We appreciate your joining us and being part of the dialogue and conversation. I do want to start by just saying we know that as we move into month 7 of this pandemic in North Dakota, that there's a lot of cumulative stress in North Dakota. And so I want to thank and share my gratitude with those individuals, whether there's parents, teachers, healthcare workers, local public health folks that we have working so hard, kids whose lives have been disrupted, grandparents, and those that are elderly that may be living in the daily fear that they may catch something that's going to cause a very serious illness or death. We just know that there's a lot of stress, and of course with the economic disruption that's also accompanied this, we know that adds to the challenges that people have, and that the people are feeling that. And then we throw into that the challenges we've had in whether it's in the oil industry or the challenging year we've had in agriculture. It's just putting a lot of pressure on people across our state and across our nation. And I think that here in North Dakota, there's a time here where we know that when we've been through challenging times in the past, whether it's particularly I think floods are some of the best examples where entire communities have been at risk or have suffered sort of the loss and the grieving that can come when you lose something, whether it's losing a flood in a house or lost time or other impacts from these kinds of natural disasters. But during those times we know that North Dakotans have risen up. We know that people have stepped up with incredible grace and compassion. We know that faith-based communities have come forward and supported people. We've seen it this fall in the ag community when one individual was unable to complete his harvest and all the neighbors came together. I mean, those are examples of North Dakota at its very best. And then I would throw on top of all the stress we have, we know that some people might say there's a information overload, but there certainly also is a misinformation overload because never at a time in our society and in our world there's been so much information at our fingertips that often is inaccurate, that is also being spread around, which just adds and fuels to the emotions of fear and concern that people have, and those can be the motive for some of that can be nothing more than the business models that are trying to capture the attention of people and on social media. So with that as background, again, I would just start by opening today to say gratitude for all of those people who are showing grace and compassion to their neighbors and their friends and their teammates, and hopefully that all of us, as we perhaps are at the point, I hope, which is going to be in history looked back as the darkest hour and maybe the most challenging time for North Dakota in the pandemic, that in this point of us going through this low point that we can look back and know that we did it with grace and compassion and understanding. Today, we're pleased to have 2 guest speakers with us, both from the North Dakota Department of Health. One is Kirby Kruger. Kirby, we're delighted to have him here. He's the Director of Disease Control. And Molly Howell, who you've heard from this podium before, our Immunization Program Manager, and she's the Assistant Director of Disease Control. But thanks to Kirby and Molly, not only for being here today, but for their incredible and steadfast work. They've been a key part of the team since the very beginning of the pandemic. And again, as we take a look and we talk about the darkest month, I mean, there's a lot of different ways to measure the pain and the loss during this, and sometimes when you look at numbers, it can just feel like statistics. But I want to start by sharing that as we concluded September, far and away from people passing away with COVID, our worst month yet. It took us 140 days battling this pandemic to reach 100 deaths, and that was in a time when we knew less about how to manage it. Today, the survival rates of people coming out of ICU ICU are better than ever before across our country with the advances we've had, but that's still not a place you want to be. You don't want to be in ICU with COVID, because I don't know anyone who'd want to be going through weeks of headaches and nausea and breathing issues that would probably seem interminable, only to come out the other side of it perhaps with lasting effects. But we are doing a better job of having people survive that but today than we were 6 months ago because of increased knowledge and care. But even with that, we still, see ourselves here with 109 deaths in September. And even if we take a look at the last week, we lost more patients in the last week of September than we did in any of the months prior. So I say this again with a sense of heartfelt loss, and because while this may be a statistic number here, we know that each one of those individuals was somebody's grandmother or grandfather, father or mother, brother or sister, a friend, a neighbor, a mentor, and we feel the loss of those families, and we know that working together that we can make sure that we slow the spread and bring those curves down again in those numbers so that we don't see any months like that ahead of us, and we can start heading back, if you will, in the right direction. 67% of those fatalities, or 67 of the fatalities, or 61% occurred in long-term care facilities in the past month, and in light of this, we're rolling out many mitigations to help our skilled nursing, basic care, and assisted living facilities to protect our state's most vulnerable population. And that includes stuff that our VP3 team has done all along, but we're going to keep, doubling down on this, that keeping COVID-19 out of our long-term care facilities, whether it's skilled nursing, basic care, or assisted living, becomes more of a challenge when we have increased spread in the community because of the number of workers that are moving in and out, and also because we want to continue to facilitate visitation between families and their loved ones, but we know that it creates additional increased risk. But facilities that are experiencing outbreaks are taking part of increased testing. The state lab is processing those. As I mentioned before, we're moving all tests from long-term care up to the priority level, so they move to the front of the line if they're coming into the state lab. So the sooner we can ID positive cases, we can get them isolated and implement infection control measures. We're taking a hard look at working with facilities who've had serious outbreaks that have led to multiple deaths at their air purification systems. There's increasing evidence that, again, that if you've got spaces where we've got your air circulation outdoors, you're much better off than indoors. You're much better off in less crowded than you are in crowded. You're much better off in places where people are wearing masks than are not. And so we want to keep focusing on that aspect of it. We also have been deploying professional cleaning services to help facilities with outbreaks to do enhanced deep cleaning of any high-touch surfaces in common areas. We're also working on coordinating staffing needs for facilities experiencing outbreaks, because if there's a number of positive cases with residents, that means that there's a number of healthcare workers who've been exposed and who sometimes also become positive because they were a close contact. But this means we're working on deploying CNAs, LPNs, and RNs to fill open shifts in facilities statewide. We'll be redeploying some of the nursing pool staff that we had to help with those, and then redeploying and getting some of those nurses that were helping on test collections and backfill those with EMTs. The VP3 task force is also providing advisement, consulting, and support services to any long-term care facility in our state to ensure that those best practices are being followed. And there's also collaboration happening between key stakeholders to take a look at revised visitation guidance as we head into the winter months here in the northern part of the country. We were able to accomplish a lot of visitation outdoor and safely this summer, but the stakeholders include the reuniting Reuniting Families Task Force, chaired by Chris Larson, who's a resident of Luther Memorial Homes in Mayville, the North Dakota Long-Term Care Association, North Dakota Department of Human Services VP3 Task Force, the North Dakota Department of Health, all working together to get input from families, residents, and facilities so that we can continue to connect residents and their families in a safe and practical manner, because the connections with family is also a key part of health. When we take a look at what we're watching, let's jump into the numbers. In terms of the statewide positivity rate, we can see the trend line overall coming up right just below 7%, 6.98%. And this is a trend line. While it's not climbing as steeply as it was earlier, it continues to climb. And as we know, this is an average for the whole state, and which means we've got a number of counties with more than a 10% positivity rate and quite a bit of testing. And we've got some counties that have got under 5% and some even under 3% positivity rate. So this is the average of that. But while we don't like the direction it's going, we do know that we're not operating in isolation. The virus does not respect any state borders in terms of its transmission. And so when we take a look at where we stack versus other states, then this is from the Johns Hopkins University data. If you look at the left-hand side of the screen, in green, those are states that have less than 5%. That's where we have spent the vast majority of the pandemic, was in that area. We're in the group now that has in the higher than 5%, 5 to 10 by the White House, considered the yellow zone from a positivity. Above 10% is a red zone or a warning zone. And we are in a relative to where this virus has moved. It started out in the Northeast, went to the South, went to the Southwest, and now has come into the upper Midwest and in the upper Rocky Mountains area. And if we take a look at some of these numbers, which are hard to see here, but Montana, our neighbor to the west, 8.3%. Wyoming at 12.6%, those Nebraska at 13.3%. These are all, I believe, the highest for any of these states. Kansas at 15.5% positivity rate, Iowa 17.2% positivity rate, Wisconsin 21.1%, and South Dakota with the highest positivity rate in the nation at 25.9%. So again, compared to the peer group of those in this upper Midwest Great Plains region, while we don't like the direction of our numbers going up versus going down, there is a tide around us which is much higher. And so again, thank you to all the North Dakotans who are doing their part to help slow the spread and to keep our positivity down. And thanks to all the people that are working around in the state lab and around in public health and in our health departments on the testing, particularly those vulnerable in long-term care, to help us have accurate information about where the virus is and how we can mitigate against it. Again, we'd like to get our positivity rate back to 5% or lower. And again, we're doing this, again, trying to be simultaneously. We talk about the dual goals of saving lives and livelihood, but our unemployment rate is, for the nation right now, we're the 6th lowest in the nation at 5% even. So we want to see that unemployment rate continue to drop, but among the best of any states, and that's a reflection of the fact that we've largely kept the economy open. As a matter of fact, the Kaiser Family Foundation reported just recently that North Dakota is among 8 states that have their economies entirely open. And so if we can achieve these dual goals of having an open economy and helping to maintain people's economic health, that always helps the physical health and the mental and behavioral health. So if we can do that and continue to have low positivity rates, that's the path we're pursuing. Another goal that we've had, or I should say before we go into another goal, but let's go into the numbers for the statewide numbers. We had 2,848 new cases in the last week. but also a large number of recoveries. Divided by the number of tests we completed, that was a 7.4%. So that's slightly higher because that's a 7-day rolling average. When your numbers are going up, your 7-day average is always going to be slightly higher than your 14 days. So the 7% I was referring to earlier is our rolling 14-day, but on a rolling 7-day, increasing to 7.4%. And again, 3,690 confirmed active cases, up about 29 from yesterday. We do have 106 people hospitalized. Since we were here last week, we have had we have had an increase in hospitalizations. We've broken into that 100% mark. There is going to be additional updates coming next week to our dashboard. We have been working with local officials and with the Hospital Association and with the Department of Health to make sure that we are getting, as we can, additional transparency out on the dashboard so that daily everybody in the community could understand how many people we have hospitalized within, at least within the main tertiary hospitals, the largest hospitals we have in our state. We want to be able to, so people can see how many beds are occupied by COVID patients and how many ICU beds and how many there are totally. And we're working to make sure that we're working to clarify the difference between licensed beds in the states and those that are staffed, because it's one thing to have a licensed bed, but it's also important that we have the staffing to be able to do that. But as hospital hospitalizations continue to climb, the COVID percentage of that continues to be very low. And in working with, had a call with all the North Dakota Hospital Association yesterday, talked to individual facility leaders over last weekend and this past week, and they're all assuring us that while they're seeing increased admissions, the majority of those are non-COVID related, but there also is this increase of COVID related patients, but they remain confident that they can meet the needs of their communities and regions. But again, this is something we want to monitor closely to make sure that we can have the hospital capacity necessary. But again, if you're concerned about healthcare system availability and you're healthy today, there's some simple actions that you can take, which include socially distancing, wearing a mask, washing your hands, avoiding large gatherings, because if you yourself do not become sick and then you won't infect others, then that'll help take pressure off of the system. One other thing I want to mention here also when we talk about this topic here is the White House call from last week. We did find out last week on Monday, we've talked about this, but as the White House had earlier announced that they were buying 150 million tests that the Trump administration had secured, and those tests are 15-minute result time, and they don't require being transported to a lab, and they're 97% accurate. So you have those initial tests are starting to come. 14,000 tests are on their way to North Dakota right now. The Binax Now rapid point of contact tests, and that'll complement our robust testing strategy that we have that's allowed us to keep our schools open and our economy open. But there's a number, these will be a complete game changer in terms of how we'll be able to use these. By the end of December, we expect to receive 220,000 of these cost-effective, easy-to-use tests in North Dakota, and that would be our per capita share. The White House announced on Monday that they're distributing these to the states on a per capita basis, and we're still working on finalizing the actual distribution plan for those tests. But one place we anticipate using them, for example, would be both in nursing homes and in school settings. For example, if a student presented in a school with symptoms, the school nurse could give a test right there in 15 minutes, know whether the person is positive or not, and even if and again, this could allow to versus that multiple day holding period where maybe somebody gets sent home for a day or two waiting to find out their test. test. Same thing within nursing homes, whether with visitation or with residents or staff. It could really be a game changer to have that information. Also, it's a game changer in terms of cost, because if there's no lab cost and no lab staffing, not only is the test substantially lower, but the labor costs, the transportation costs are eliminated almost completely. And so this is one point of great optimization. My second point of optimization coming out of the White House call on Monday related to vaccines, and there continues to be strong progress among multiple U.S. Pharmaceutical manufacturers that are moving through very large human vaccine trials. And if we were to see say in Q1 of 2021, a vaccine that could be used for people 70 and older in long-term care facilities and really reduce their risk, that would also be a game changer in terms of how this country and our state could be working our way through this pandemic. I want to take a look at the counties next, if I could. In the county, active cases by county, again, darker on this means more cases. These are just the numerators. These are just the raw number of cases. These are not at all divided by the denominator, which would be population. But we do see here on this map that of the 53 counties, again, all but one have at least one active case of COVID. So there is a disbursement across the state. It is concentrated in the counties that have more population. Burley has 684, that's the most, an additional 265 in Morton County, combined Burley-Morton County, 940 cases right here in Burley-Morton. And again, the Burley-Morton Task Force continues to work to try to address this, but again, people that are shopping or coming into Burley-Morton, again, you've got say a higher percentage chance if we take a look at the active cases per 10,000, which is where we start dividing by population. You can see that in Burley-Morton or in Stark County, where there's 319 cases, but that translates into over 90 per 10,000. That is, there's 3 times the concentration of cases per capita in some of our western counties than we have in some of our eastern counties. And so again, we also look at the per capita rate there. Emmons County leading the state in terms of a low population county, but leading the state in terms of cases per capita. And again, we've got as we've talked about, and we met this week with local city leaders, there's some great work being done on the city and the county level in these areas of high activity as people are taking mitigation steps at the local level to try to address their unique situation. On county risk levels, this is something we've talked about every week, where we've got the five level risk. This week we're announcing no changes to the September 23rd risk levels. We of course continue to monitor all of the positivity rates and the concentrations and the directions that they're going, but we'll be back taking a look at providing any updates to this over a 2-week period next week. So we'll have potentially have some changes both up and down next week, but for this week we're leaving everything where it was as of what we announced on September 23rd. The next topic we want to talk about is a important one, and it has to do with the topics of isolation and quarantine. And let's get clear on the 2 words. Those isolation is something that if you're positive, then you should be isolated, because if you're positive and you're contagious, then you should be in a position where you're not in close contact with any other people. People that are attending to you should be thinking about using PPE to protect themselves, but you want to be isolated so that while you're positive, your first thing, of course, is to take care of yourself. If you've got symptoms, contact your health providers and make sure that you take this disease seriously, but you should be in a position where if you know you're positive, then you're not transmitting to anyone else. Quarantine is a procedure where people who've been exposed to someone who's positive, we ask them to quarantine. We do know from the studies we've done at the university students through the NDUS that about 25% of the students that were quarantined were because they had a close contact with a positive, later turned out that they also were positive. Statewide, the numbers are a little bit higher. They're 29 plus percent, so close to 30% on of all of the people that have been contact traced who were a close contact later turned out to be a positive. So this is an area where we know that there is a substantially higher likelihood that you will contract COVID if you've been identified as a close contact. But having said that, so we know there's risk, we want to make sure that we're achieving the most compliance we can, and to make sure, we want to make sure we're providing some clarity to our quarantine guidance. But there's we know that right now that again COVID is also transmitted primarily through the air, human to human, and so it's again, if humans can stay away from each other, then the virus has got no place to live, and that's why again we keep talking about these guidelines over and over again. But these are common sense measures that don't infringe on anyone's liberties. That are not these are guidelines, not mandates. So you can choose to do this as you care about others in your community, which is keep your distance, wear a face covering. If you can't socially distance, wash your hands frequently, avoid large gatherings, and stay home if you're sick. And let me just say something again on masking and face coverings. Think about it, when a mask or a face covering as someone who might, if they know they're going to cough, they cover their elbow. And if in pre-pandemic, if you were in a close conversation with someone and they had a cough and they turned away from you or coughed into their elbow or excused themselves, you probably would, say to that person, or if they sneezed, you might say Gesundheit in parts of North Dakota, but you would say, you're basically seeing that what they're doing is acting out of consideration for you. They're not trying to keep themselves well. They're trying to protect what just came out of their nose or mouth from their cough or their sneeze from going on you. That would be, common courtesy that we all practiced, I think, all the time, almost uniformly. Putting a face covering on is kind of like covering your cough, only you're doing it because we now know that when you're asymptomatic, you can still be a transmitter of this disease. And so again, I say, as I said last spring, the one thing, if you see someone wearing a mask, there's one thing to say to them, and that's really thank you, because they're protecting you the same way they are when they're when they're covering their cough if they were in your presence. And so again, this is just a common sense thing that we knew before the pandemic, that it was not a good deal to cough or sneeze directly in someone's face. We knew that if you're a surgeon doing surgery, you wore a mask in case you might have sneezed in somebody's open surgical incision. I mean, these are just common sense things that we all understood, and so we're trying to bring that common sense forward, that keep our distance and wear these face coverings if you can't. We know that we've got this spread that's increasing in our state, and we know that we can work together. We know that we're outperforming other states in the region that are because of the great work that all of you are doing, but we know if we can get it back under 5%, that's the way that we can ensure that our businesses stay open and our kids stay in school and that we save lives. We've met with North Dakota school leaders about how school is going this fall, and we know that in-person classes have resumed at both universities and many of our K-12, that we've dialed up the number of transmissible moments, and one of the frequent areas of frustration among parents and superintendents and students is the quarantine guidelines for close contact. And because these are difficult, we also know that we've had challenges on compliance on these, and we're looking for ways to have increased voluntary compliance. And when we have increased voluntary compliance, it does a lot of things. It does help save lives. It does preserve hospitalizations. hospital capacity. So we have been digging into in the past week, working with our medical experts to see if we could update our current quarantine guidelines. And today we are announcing a change. And we're announcing a change that the quarantine guidelines for a close contact who was wearing a face covering, and the person who was a positive case was also wearing a face covering. If those two people were exposed, were both wearing face coverings at the time of exposure, then we're changing the way we think about quarantine. And again, this should provide more clarity for parents and superintendents and employers, and it's here to explain those changes. I'm going to turn it over to our Disease Control Director, Kirby Kruger. Kirby's an epidemiologist. He's served the state for a long time, deeply steeped in how epidemics work and how to stop them. And so again, I want to thank him not only for being here today, but thank him for all the great work he's done throughout this pandemic. Kirby, welcome.
Thank you, Governor Burgum. And I appreciate everybody being here today. More and more, we have evidence that is showing that masks are highly effective in reducing the risk of transmission from an infected individual to their close contacts. There's been studies that have been, case series that have been published, and the CDC this last summer released in their Morbidity and Mortality Weekly Report a case study involving hairstylists in Missouri, where two hairstylists were working while they were infectious, and at that time in this particular salon they had a policy where people were masking pretty routinely. They were masking, and among their clients, most of them were masking, and among the 104 clients that were interviewed, 98% had expressed wearing a face covering or a face mask for their appointment, and no one was diagnosed with COVID-19 from those exposures. So those are very close contacts and very close exposures. There's other studies that have been done, and they show that masks are highly effective in reducing the risk of transmission of this virus. So I think the idea is that when we can wear masks and we can wear them correctly and consistently, that they are highly effective, and there's good science to back that. So we in the health department, we got together, we met amongst ourselves, people in disease control, from the state epi office, from our school team, and consulting with some of our physicians who we consult with. We explored this a little bit more in terms of what can this mean for a policy. And so, as Governor Burgum mentioned, we are updating our guidance as a result of our conversations, and the result is that our quarantine policy will reflect that in a non-healthcare setting, in a non-residential setting, when the positive case and the close contact have both been correctly wearing a face covering or a face mask for the entire time that they were in contact with each other, the close contact will not need to self-quarantine at home, but instead we will ask this close contact to self-monitor, which means that they should be watching for symptoms, they should be wearing a mask at all times, like they're supposed to be doing. They should also consider testing, especially if they develop symptoms, but also testing if 7 to 10 days down the road. And they should be social distancing as much as possible, as practical. And so those are the recommendations. So our definition for a close contact hasn't changed. It still continues to be an individual who has been within 6 feet of an infected person for a total of 15 minutes during a 24-hour period. People who are close contacts that weren't wearing masks, where both one party or the other, or both parties were not wearing masks, would still need to be quarantined from the 14 days of their last exposure. Now, this does not change isolation. Governor Burgum gave a great epidemiologic lesson in talking about the difference between quarantine and isolation. This doesn't change isolation. People who have been diagnosed with COVID-19, we are still asking to isolate for at least 10 days, and they have no fever without fever-reducing medication, and their other symptoms are improving. I think the steps that we have taken here are embracing what we understand about masks and the science behind the masks, and that wearing masks have direct impacts on the spread of COVID-19. We emphasize always that individuals can continue to stay home when they are sick. They should keep 6 feet distance from each other as much as possible, wash hands frequently, and sanitize frequently touched surfaces. We appreciate all of North Dakota doing their part to help keep our state safe. Thank you.
Thank you, Kirby. We certainly appreciate the expertise and input from Kirby and other medical professionals like Dr. Connell, Dr. Carson, and others that have been working as part of our Department of Health team during this pandemic. What Kirby just announced is a common sense approach that's going to create an actual incentive for people to wear masks and face coverings and provide for a more positive school experience for students, faculty, administrators, and parents. And let me talk about that incentive. Let's talk a little bit about how this will work in practicality on what Kirby just announced. If someone turns up positive, but they were wearing a mask and the other students in the classroom that might have been sitting near them were wearing a mask, or if they were sitting on a bus and everybody on the team was wearing a mask, at the time that one positive on the bus turned, we have one positive on a bus and everybody was wearing a mask and the person was positive wearing a mask, those other people on the bus or on the team or in the classroom have to monitor themselves, continue to wear a mask, continue to social distance, but they're not going to be required to do the 14-day at home. They're effectively just monitoring and mask wearing during this time frame. I guess if I was I'm still a parent. I had kids that were in athletics. I had kids that went through K-12 in North Dakota. This is a big incentive for parents to be role models for their kids and say, hey, let's mask up as a family to make sure that nobody in our family is positive. And hey, kids, when you're getting on the bus or going to school or doing what you're doing, wear a mask, because then if somebody else turns up positive, you're going to be not have to quarantine. And if you're a young adult or a college student or you're an employee or you're going to a place of business and you're wearing a mask, and if you have other people that are wearing masks and a positive turns up, then you're going to be okay. So you've got an incentive to hang around with other people that wear masks. You've got an incentive as a coach to make sure that everybody on the team is wearing their masks all the time, because this is a way that you can avoid the 14-day recommendation and you can fall under the new guidelines, because to fall under the new guidelines, you need to be both wearing a mask. I'm sure there'll be questions that come up about retroactivity of this, but for those folks that fell in this situation already, where they were deemed a close contact, but both the positive and the close contact were wearing masks, then this also applies to you. So it does apply retroactively if both parties were wearing masks. Next up, we'd like to talk about our next topic, which is flu shots. And again, I'm wearing my red button this year because I've already gotten mine. I got mine last week. I get mine every year. Last year we had a press conference right here at the Capitol about getting flu shots, and it was as sad as this pandemic has been, I will not forget that day, because we had a young mother that was there whose child, a beautiful daughter, just over 2 years of age, that came down with the flu, died a few days later. And it's a reminder for all of us to get our flu shots, to protect young children, to protect elderly adults. The flu, again, has a much bigger impact and a different impact in a wide range of ages. But we did have last year an estimated 549 influenza-related hospitalizations last year, and 426 people died from the flu or pneumonia last year. 12,000 reported influenza cases in North Dakota last year, and as has been reported widely, if we have 2 respiratory illnesses circulating at the same time, some which present with similar symptoms, if there was ever a reason to get a flu shot, this would be the year to do it, to protect yourself, your family, your coworkers, and any of your loved ones around you. And here to talk about this, Molly Howell, who I introduced earlier, who leads the immunization programs of the Department of Health. But Molly, thank you for being here, and thanks for all your great work on educating and keeping North Dakotans safe. Molly?
Thank you, Governor Burgum, and I'm glad you got your flu shot. I'm getting mine this week, and I hope everyone is marking a time or a date on their calendar of when to get vaccinated against influenza. Ideally, this year, we want everyone to get vaccinated before Halloween. The reason for that is because we may have a COVID-19 vaccine coming sometime this winter. There could even be doses, and so we want to make sure that we're vaccinating everyone for flu before COVID-19 vaccine becomes available, and then also before flu season starts. And so everyone 6 months and older is recommended to receive influenza vaccine. It's especially important for a lot of the same people that are at high risk for COVID-19 complications, and so people with diabetes, lung disease, heart disease, the elderly. Also, it's really important for children to be vaccinated. They can spread the flu. Additionally, last year in the United States, 188 children unfortunately died due to influenza, and so it's also critical for children to be vaccinated against influenza. I want to mention some of the things I hear about flu vaccine. A lot of times people say, well, the flu vaccine doesn't work. Last year, the flu vaccine was 39% effective at preventing someone from having to go to the doctor due to influenza. That's not as great as we would like it, but that means we prevented 40% of people having to go to the doctor. Imagine if we had a vaccine right now to do that for COVID-19. I also want to mention it's especially important during COVID-19 to get vaccinated against influenza. Governor Burgum mentioned the number of hospitalizations we had last year. We don't want to have influenza hospitalizations on top of COVID-19 hospitalizations in our hospital and taxing our healthcare providers. Also, the flu and COVID have very similar symptoms. They're both respiratory illnesses. It will be very difficult to tell the difference between COVID-19 and influenza without testing, so that'll also place an extra burden on healthcare providers to have to test for both flu and influenza, or flu and COVID-19. It's also important to be vaccinated so you can keep going to work, so you can keep sending your children to school or daycare. There's a lot more screening going on for symptoms. I know before I come to the Capitol every day, I have my temperature taken. That doesn't happen in a lot of other years. And so in order to stay active and going to work and school and childcare, it's important for people to be vaccinated. Last year in North Dakota, 56.5% of North Dakotans 6 months and older received their flu vaccine. We hope this year it'll be much higher. Already, looking at data from the North Dakota Immunization Information System, as of this time last year, 26,308 people had received their flu vaccine. This year so far, 47,415 North Dakotans have already been vaccinated against influenza. That's over 20,000 more doses given compared to the same time last year. And so while there is a lot that seems to be out of control during the COVID-19 pandemic or things that we can't control ourselves, the one thing that everybody can do is to go out and get an influenza vaccine. It'll not only protect yourself, but protect your loved ones, your friends, your community, and also help out our healthcare providers that have been working so hard in responding to the COVID-19 pandemic. Thanks.
Thank you, Molly. And thanks, Molly and Kirby and the whole team for all the great work they're doing. They'll both be available for questions afterwards. The behavioral health update for today. We know that COVID-19 has created barriers for people in seeking recovery, including challenges around isolation, stress, and uncertainty. There have been some great things happening, however, in our state. One of the things we heard from all of the hospital administrators this week was all the advances in telehealth. There's a continued work that we can do working with the legislature on cutting red tape, but one of the things in a rural state like ours where we had a shortage of addiction counselors and a shortage of behavioral health specialists to work with people, it's been proven that that works very effectively in a telehealth setting, and the systems have really advanced to be able to do that. So we've got some work to do to continue to make sure that some of the things that are happening now, some of the changes we've made during the pandemic are something that can be permanent changes to help us make sure we're delivering services to everybody in the state. So there are some bright spots in terms of delivery and reaching everyone in our state. But a great opportunity for people looking for information, resources, and hope is to attend the 4th Annual Recovery Reinvented. It's a free online event hosted by the First Lady and myself, and it's free because the work around Recovery Reinvented is been paid for and by sponsors who will be honored during that day on the event, but thanks to all those sponsors that make it possible. Yesterday, the First Lady and I were thrilled to announce that we'll be joined by 2 phenomenal advocates in the addiction and recovery space. One is addiction specialist and national commentator on addiction, Dr. Drew Pinsky, and then also the best-selling author, David Sheff, who some people might know. He's the author of a very touching book called A Beautiful Boy, A Father's Journey Through His Son's Addiction, which is also made into a major motion picture. Dr. Drew is a diplomat of the American Board of Internal Medicine, the American Board of Addiction Medicine, regular television speaker and voice on addiction-related issues. He'll be sharing his insights around strategies to eliminate the shame and stigma and the connection between mental health and addiction and emerging addiction challenges brought on by COVID-19. And he'll be exciting to have him back. He spoke in North Dakota back in 2019 at the Behavioral Health Conference and did a fantastic job. David Sheff, chronicled his experience with his son's addiction, relapse, and recovery, and he's an advocate on issues surrounding the U.S. drug crisis, and he was named to Time Magazine's list of the world's most influential people way back in 2009. Other featured speakers include Dr. Stephen DeLacy of the Hazelton Betty Ford Foundation, who's an expert on adverse childhood experiences. We'll have local providers and clients who will share testimonies, and we're also going to feature a great local success story that the First Lady had an opportunity to highlight at a conference at the White House earlier in September, featuring Solid Comfort, which is a Fargo-based manufacturer of hospitality furniture, but they developed a recovery-inclusive workplace known as Solid Start, and they're one of the largest employers hiring people directly coming out of our corrections system, and they've had great success and doing great work. So again, Recovery Reinvented's free, open to the public. Continuing education credits will be available. This year, as I said, it's going to be virtual, but for more information on the event and to reserve your space or to submit a video of your own recovery story during this COVID-19 pandemic, please visit recoveryreinvented.com. Next announcement relates to the Main Street Summit. And since COVID-19 pandemic impacted North Dakota, the resiliency and economic development have emerged as top priorities. The Main Street Summit coming this next Tuesday and Wednesday, just right around the corner, October 6th and 7th. It's going to be a perfect opportunity to have a statewide virtual conversation about the future and resiliency, and with a focus on building resilient communities. The conference is held in partnership with the Economic Development Association North Dakota Council on Arts, and the Prairie Family Business. We'll have keynoters from national speakers from around the country who will bring experience and knowledge to continue building resilient, healthy, vibrant communities. And also, we're going to have community leadership podcast veterans, Dennis Frazee and Jason Hutchinson from Develop This, well-known nationally for their great work, also are going to be presenting. And so we've also got, in addition to the top educational speakers, we'll have special guest appearances and breakouts that are going to be sponsored, including some local musician and talent, including Jesse Vetter, Chuck Suchy, and other regional artists. And registration is now open. It's only $20 at Main Street Summit ND. This conference provides volunteers, community leaders, students, and professionals an opportunity to attend the largest community development event in our region. For more information and to register and save your space, mainstreetsummit.nd.com. On the good news component, as we wind up here, update from the North Dakota Department of Commerce announced that the economic resiliency grants, these were the grants that came from the federal coronavirus relief funds that were approved by the budget section in the Emergency Commission. It's reached 2 milestones. As of today, Commerce has reported it's successfully adjudicated more than 1/2 of the applications they've received, totaling more than $20 million has been rewarded to 1,000 North Dakota businesses for grants to help them put in infection control and other measures in their businesses to help restore consumer confidence. The small businesses with less than 25 employees represented 80% of the businesses that received ERG funds, and the amount of applications received indicates the strength and determination of North Dakota businesses. They are certainly rising to the challenge in ensuring the safety of customers and employees while restoring consumer confidence. So congratulations to those that have received their award, and if you haven't yet, I know the Commerce Department is staffed up and is working around the clock on moving through those additional grant requests. And in closing, with a quote around gratitude, Ralph Marston, who's an American writer, says, make it a habit to tell people thank you, to express your appreciation sincerely and without expectation of anything in return. Truly appreciate those around you, and you'll soon find many others around you to truly appreciate life, and you'll find that you have more of it. And I think this is very fitting with the announcement, change in policy made by Kirby today in the Department of Health, which again, this is going to be an opportunity to say to your teammates, your classmates, your friends, your family members, anybody around you, if you're trying to make sure that you stay healthy and avoid either getting COVID or being quarantined by close contact because you've got something important coming up in your life, whether it's a concert or a tournament, this is an opportunity to say thank you to your teammates and classmates and parents and friends if they're wearing a mask around you, and they can return and say thank you back to you for wearing a mask, and we can preserve hospital capacity and preserve livelihoods and save lives. So again, thank you all, and thanks everybody in local public health and the health department that worked so hard this last week to get these new guidance changes made in time for today's press briefing. With that, we'll stand for questions, and again, both Kirby and Molly are available for questions. We'll go to Lane first and then online.
Governor, the number of deaths has definitely been in the headlines recently, and looking at the COVID-19 healthdata.org projection, North Dakota is projected to be around 600 by the end of the year. Does the state have their own projection and any plans to help mitigate that?
Well, I know that how some of those prediction engines work, and they take the trend line we have and then they continue it. And if we don't see increased compliance around mitigation, continue to see increased community spread, that could be a result that we would have, and that would be tragic. But it's up to all of us. It's up to local community leaders. It's up to every individual to do their part to help protect the most vulnerable. We're going to do everything we can from the state standpoint to serve those congregate facilities in long-term care where we know they've got high risk, but we'd like to prove those predictions wrong by taking this trend line where we had more in September than we'd more in the last week in September than we'd had in any month. You can see why that would put a prediction engine moving things upwards, but we definitely want to see that line coming down, but that's going to take effort from everybody. Danny?
KUIZ Williston, do you remain confident in the people's ability to be socially distant and to wear masks when applicable?
I would say that on today's announcement, I've got increased confidence from where I was before, because I think we had a system that was set up before where, based on where you were in your life, either economically or emotionally or wherever you were, there was probably a lot of disincentive to be named a close contact. There was a lot of disincentive to to even admit if you'd been around somebody who was a positive, and a disincentive for you personally, because it might have mean you were missing a game or missing school or missing your job or missing something that you wanted to do. So there was a cost to you personally, and if that cost to you personally is high and you're asymptomatic, it might be easy to rationalize, well, hey, I don't feel bad. Why would I want to quarantine? Because I don't think I'm spreading, but you don't know. You might be, because if you haven't been tested, you wouldn't know if you were or you're not. So I think that the hardest job in the state of North Dakota in the past few months has actually been people that work in the health department that are trying to, in disease control, and people that work in contact tracing, to call someone and try to find out and to tell people, hey, you've been notified as a close contact. Those were not probably fun conversations. And I guess I would ask the citizens of North Dakota, if you do get one of those calls, if you could also respond, as many of you do, respond with a thank you and say, hey, thanks for notifying me that I was a close contact. We do have numerous cases all across the state of where contact tracers have received verbal abuse from people who've been reached, and this saddens me, because again, these people in public health that are working contact tracing, they're calling to let you know that you may have been exposed to something that could be deadly to you or your family member. They don't know when they're calling you. If you might have a son or a daughter who's got an immune deficiency, they don't know that you might be living in a multi-generational household with a grandmother that's 80 years old that's got underlying diseases. They're calling to let you know that you've been exposed. That's why they're doing it. And so there shouldn't be any really room for that kind of reaction when we've got people that are just, again, trying to serve the people in the state to help protect lives and help keep your business open, help keep your kids in school. So my confidence level goes up. It goes up because now there's an incentive. If now when you get a call and you've been named a close contact and they say, were you wearing a mask? Yep. Was everybody around you wearing a mask? Yep. Okay, well then you're not going to have to sit on the sidelines for 14 days. And so I think now there's actually a great incentive. If you're worried about losing 14 days of your life and you want to make sure that you get it back, then it's pretty simple. Just wear a mask when you're in a position where you can't socially distance. Because it's not, they're not going to ask you, were you wearing a mask in your car when you're driving by yourself across the state? They're going to ask, were you wearing a mask when you were within 6 feet of a person who tested positive? And we all know what 6 feet is. Just stick your arms out. So either stay further than 6 feet away or wear a mask. These are free. That's free. That doesn't infringe on anybody. You can do that, and then you don't have to worry about being named a close contact. You don't have to worry about spreading the disease. You can be part of the solution. And so again, I'm optimistic that with these new approaches that we have alignment now and incentives in line for people to voluntarily do the thing that's going to help them, their family, their classmates, and their schools and their cities and their universities. Okay, I'm going over here. I'm going to go with all the way to the back first to Jeremy, and then I'll go Jacob, Jack, and up to Tom. Jeremy?
Governor, why did Dr. Paul Mariani resign last week?
Well, Jeremy, I talked about this extensively on radio and on other interviews. I think it's been widely covered. I've talked about it in numerous public meetings, and I think that there's I said that's all been covered. As I said then, he was doing a great job. We wished he would have stayed. I spent 2.5 hours trying to recruit him to stay last Friday. But it's, and we're sad that he left, and we're gonna, we got a search open to find somebody new, but I think there's plenty of things on the record about that discussion. Jacob?
What was the nature of your disagreement with him regarding the rescinded quarantine order?
There actually wasn't really a disagreement in that sense. He, as I've reported before, he agreed with the logic on what we were doing. I think that it's, and I have to own this, and I owned it then, I own it again at the time, which is it was a miscue on my part. That's been reported. It was a miscue because I allowed a amendment of an order that existed from April. I mean, to be clear, there was no executive orders issued last week related to this. It was an amended state health officer order. It was on the books from last April that household contacts were subject to the only penalties available to the state health officer. This has been on the books since the 1980s. It originated during the HIV. It makes complete sense. Every state health officer in the nation has enforcement procedures that they can put in place if somebody's endangering the public because of their health, and those are on the books, and they should remain on the books. The state health officer can still deliver an individual order, but Dr. Mariani noticed that it said it said household contacts and not close contacts. As I shared here, we know that 30% of the close contacts turn into being positive. And so he's like, hey, this makes sense to amend it. I'm like, hey, it makes sense to amend it. So I announced it here for him whatever day that was, Thursday morning. And there was a firestorm of misinformation, everything from the fact that I'd issued an executive order to we were going to be fining people for all kinds of things and imprisoning people, when in fact in the 6 months that the order had been on the books, it had never been implemented once. Dozens of times I've said here that we are going with a light touch of government, and that we know that it's not what government says, it's what people do. And so that was our strategy. It wasn't a change in strategy. It was just a mistake in terms of the underestimating the reaction that people might have to a previously existing health order, which we amended. So then when you ask a physician who is a flight surgeon for the 119th, he works for the National Guard, he works for the VA. You ask that individual to say, hey, let's amend this order. And he's like, hey, I'm not sure I want to have my signature on that amendment because it goes against what I think the CDC guidelines are. And I said, hey, I get that. And then he said to me, but I get why you want to get rid of it, because it's actually, the reaction that was occurring during those days, I think was to someone like Dr. Mariani, who doesn't live on social media, I think was also a shock to him. And it was how do you, if we're trying to get increased compliance, how do we get increased compliance? Then that's what we're focusing on. That's what we're announcing today is a plan to get increased compliance. So I'm disappointed that he left, but I think one of the challenges we're going to continue to see in recruiting state health officers is that there is a perception that there is some legal liability for people in that position based on what they do. And I think, again, then it's an impossible spot. If you're going to take on the legal liability, if somebody thinks you have legal liability, the state health officer, for taking on the actions of everybody in the state, then I would think that no one should want to serve in that job if that's the real setup. So I respect him completely about the decision that he made. Wished he would have stayed and worked through it. He respects the decision that I made. And like I said, he was doing a great job after 2 weeks. And he's going to continue to support us any way he can. He was working with us through the work on the Red River Valley Task Force, and he's working with us through the National Guard stuff. And if there is a way that, if there's any way that he can help, I know that he'll continue to do that. But as a physician, he didn't want to have his name on that order. Okay, Jacob.
Governor, no one is going to deny that it's a difficult job to hold, but in the statement that was released by your office when he resigned, he said the handling of the order it made the job untenable. And there were also emails that came out amongst legislative leadership that said that they called for the order to be rescinded, and then the next day it was. That doesn't sound like the situation was purely just confusion over paperwork from April.
Well, Jacob, I think you're conflating a couple things together there. But when you say it's untenable, I think I just described to Jeremy what was untenable. What's untenable was that he didn't like being put in a position where he made an amendment to somebody else's order from April and then was asked to rescind both the April order and his amendment, and I think the handling of it, again, has to do with the idea that which is welcome to the arena, which is that every aspect of this is, as you've noted, becomes public. There was, he was getting texts from around the country. There was, from colleagues, there's legislators. You guys all saw it. There was a huge hue and cry about something. And I'd say the hue and cry massively disproportionate to the fact that we had never implemented it at all and weren't intending to implement it. So, but I get the reaction. That's how it works. We have talked to legislative leaders and said, hey, guys, if Dr. Mariani if we could have said to Dr. Mariani, hey, can you amend this thing so it's like a speeding ticket? Because right now, if you go 70 miles over, you're driving around the interstate at 75-mile speed limit. If you're driving 78, you probably don't expect to get a ticket. If you're driving 85, then you might go, hey, somebody might pull me over, but if I'm 9 miles over, I might get a fine, but no points. If I'm going 20 over, yeah, I'm going to get points off my license and I'm going to get a bigger fine. If I'm 50 miles over and I'm intoxicated, guess what? Then you might not just be a misdemeanor, then it might be reckless endangerment, might be felony, depending on how much you've been drinking. There's no scale for the state health officer. He's either got nothing on enforcement or he's got a misdemeanor. And the misdemeanor in code says 30 days and $1,500 fine. And people focused on that, and it was a sideshow and distraction because they were focusing on an enforcement penalty in code that we never intended to use, but he didn't have an option. So what was partly untenable, if he could have said, hey, I'll amend it, but I'm going to make it an infraction, and it's going to be a $20 fine, then he might have said, hey, I can do that. But it was, we were stuck in an all or nothing situation. So we're learning things as you do when you go through a crisis like this. You find things that need to be fixed, and I think that's something the legislature should look at next time, because that'll give state health officers the kind of flexibility that anybody else in law enforcement would have the ability to do, to have gradients based on it. And I would say, again, we did issue one order last spring, and I think very appropriate. We had a positive case that was going into a very public establishment repeatedly who was positive, and the county sheriff can't say, hey, go home, we think you're sick. You need a state health officer to remove somebody in those situations, and so it's important to protect the public that state health officer has that capability here like they have in every other state in the nation. Okay, now I feel like I've talked about that again for like the 6th time. Hopefully everyone's got it. Can we move on? And Jack, what do you got next? Something unrelated to that?
Afraid not. What's the
wow? Okay.
What's the
slow new day?
What's the future of this position, and has this turnover caused a loss of credibility for the job? What really is the role between the state health officer and the governor?
Well, I think the state health officer is a dual role, and it's a dual role of you have regulatory authority and enforcement authority in code, but you're also the person who's managing and leading a 200-person agency. And one of the things that we said earlier this spring when we created the strategic task force is you got an agency that's been asked under normal times to do a full-time job across the board of everything they're doing, to then all of a sudden have to scale up, and not a little bit. We're not asking the health department to do 10 or 20% or 30% more work than they would do normally. In some cases, like the lab, they're doing 30 times as much volume as they did before the pandemic. So in some ways, it's the workload contact tracing, maybe if you had, again, 30 times, we might have had, 10 people part-time doing it. Now you've got hundreds of people working across that. So the job is like not even comparable to what it was last spring. And I think then if you throw in the potential risk of liability, it's going to be a very difficult position to fill. But when we created with Dr. Wynn doing the statewide strategic task force, we said, look, people that are dealing with a crisis after crisis after crisis every hour aren't going to have a time to look long-term to think about strategic planning. Let's pull a separate set of people who aren't caught in the tyranny of the urgent to work about long-term. That's that long-term health department. The relationship with the unified command, the governor's office, is we're trying to provide all the support that we can out of our office, out of the National Guard, to support the health department. It's a whole of government approach, but when you look at the hundreds of guardsmen that have been assigned to help work in that agency, again, it is a completely different operation. It is the tip of the spear in terms of our fight statewide working with local public health. And so, getting somebody who wants to jump into that battle and take a pay cut from what they were making as a doctor in their practice and have the potential for liability, it's a hard thing to do. And I'm grateful for all three of the people that have served in that role during this pandemic, and they've all made contributions. They've all been kind of passing the baton forward. And Dirk Wilkie, who's in that position today, again, as he did for a couple weeks in September and the last week, the guy is, when even as an interim, you're thrown into a position where that guy is, it is 7 by 24. I mean, again, people get in these positions and they're not really even hardly allowed a chance to sleep. And so I think that, again, I've got great respect for the people that have served in that role and anybody that would consider jumping into that role. But it's a very tough setup the way it's set up in code right now. Okay, I think, I did Jacob. Okay, it's going Tom and then Dave.
Governor, within the 2 o'clock hour, we reported that the Public Works Department in Williston has quarantined over a dozen people, and it's connected to at least one positive test out of the garbage department in Williston. But we've known about this since Monday, and yet there's been no talk about it from the administration at the Public Works Department. So we've been getting calls from workers. There's 105 people who work in public works saying, people are going home, but we're not knowing why and what's going on. Is there some guidance from the governor's office that's needed to quickly give employees, especially government employees, notice that somebody in their area has tested positive for COVID-19? And also to the health department, I'd like to know how important it is, do they think it is, that people be notified quickly that others in their area have come down with COVID-19?
Well, first, let me just say we had a statewide call yesterday where we had our counties that were at moderate risk, so the higher risk levels in the state, the ones that sort of the middle yellow ground, and then also had large populations or large number of cases. That included Williams County, and Mayor Klug from Williston was on there. And I just want to say I think he's doing a fantastic job of really providing strong local leadership. And in some of the larger cities, I know across the state where you've got public works, where maybe you've got a water division, a garbage division, some of those folks early on were creating separate break rooms, separate start times, separate everything, so that you would reduce the number of potential contacts between them. I don't know specifically if that was done in Williston or not, but if cities haven't done that and you're in an area of high risk, creating that additional compartmentalization so that you lower the spread of the risk. Obviously, in terms of notification, that's going to come from the health provider is going to give the positive test information back to the individual, follow up with that individual, give them a call, who are your close contacts, they report that, then the phone calls start from contact tracers to notify people, and we're trying to do that as quickly as possible, because the sooner we can notify people, the better. But it seems to me that, again, some of your question would be a good one to direct back to the Mayor Kluger, the city of Williston, but it seems to me like from from everything I saw yesterday, the mayor's doing a fantastic job providing leadership for the whole area. Okay, Dave?
This is from Molly. For Molly?
For Molly, okay. Molly, and then I'm gonna go to the back, and then to Jeremy, and then we'll swing back over to online again. Molly? What was your other question, Tom?
How important it is that notification be quick.
Okay, I'm sure, could you hear that? Molly, one of the questions was how important is notification is quick, and then Dave's got a question for you. Thank you.
Yeah, so when somebody with COVID-19 is reported to the North Dakota Department of Health, we follow up with that individual. We contact them within 24 hours. And that's because it is important to notify them right away, make sure they're isolating and staying home away from others. And then we interview them to understand who their close contacts are. And then we notify their close contacts. So it's critical to notify them right away so that process can start. And in terms of employers, we have a workplace team that follows up with employers that are seeing clusters of cases, and we have guidance on our website for workplaces that are experiencing cases, and they can always call our hotline too, and we would provide them with guidance on how to mitigate and prevent future cases. Yeah. Dave?
Molly, given the demand so far that you said it's about double the number of people getting shots so early, are you confident we will have enough vaccine for everybody?
Dave's question was if I'm confident we'll have enough influenza vaccine for everybody who wishes to receive a dose. I am confident that we'll have enough influenza vaccine. It's estimated that almost 200 million doses of flu vaccine will be available this year in the United States. That's about 12% more than last year. And the North Dakota Department of Health, very early on actually in this pandemic, we ordered an additional 10,000 doses of influenza vaccine to ensure that we had doses, especially for adults who were uninsured or underinsured and couldn't potentially afford influenza vaccine. Thanks.
Okay, in the back.
I'd like to drill in a little bit on what's going on in long-term care facilities right now. Early in the pandemic, North Dakota adopted new rules for regulating long-term care facilities, reducing the amount of hours needed for a temporary employee from 75 to 8. Given the spread of the virus within long-term care facilities right now and the spike in deaths, do you have any question about whether that change in rules for hiring temporary employees in long-term care facilities is premature?
Well, I think as I stated earlier, some of the mitigations, we've got real concern about, the fact that, 61% of these deaths we saw in September that were in long-term care, and our long-term care team, the Vulnerable Population Protection Plan led by Chris Jones, is looking at all these, mitigations. We're going to retake a look at visitation, the air purification systems, the deep cleaning systems, the increased testing, making testing a priority, all of those things that we're doing. But in terms of the workers, that's also something, again, and whether it's regulations about hours they work or regulations around testing, because we know that when we've got high amounts of spread in a county like where you're seeing, we saw take Morton County, for example, where we saw cases go up, then cases go up in the community, then those cases get into long-term care facilities, and then we see, deaths increasing in long-term care facilities in that county. So then it's part of what we're doing for long-term care is making sure that we're actually fighting the right fight in the community, because they're a reflection of the community, as in addition to being a reflection of whatever mitigations they have kind of on that the last wall there, if you will, to try to protect them in that congregate facility. But we'll take a look at that. I don't know the exact specifics of the what you said there, but it's one of the ones that I'm not what you said. I heard what you said about regulations relative to temp workers, but I'm going to take that back to Chris Jones, and we'll add that to our list of things to look at, because we really want to look at everything. It's unacceptable to have this many deaths in North Dakota. It's unacceptable to have that many in long-term care, and we'll take a look at everything. But I'm excited about the testing, the being able to use those Bionox rapid care tests. I mean, think of the advantage of being able to identify if someone is positive or negative now versus finding out in 48 hours if they're positive or negative. Think of being able to, to not just test workers once a week when they come in, but to be able to test them more frequently and do it at a fraction of the cost and have them know, like right when they're coming in the door, are you positive or negative? So there's some game-changing tools that we haven't had before that I hope can help protect the most vulnerable.
No, if you're not familiar with the rule change, then no problem. I just want to clarify the point there that there were relaxed rules around hiring employees in long-term care facilities. So the question is whether the reducing the amount of training needed for someone to work in a long-term care facility potentially makes people within that facility more vulnerable to spread the virus.
Well, I think it's we want to lead with curiosity as well as gratitude. So, I mean, I think it's a question, a valid question worth asking, and certainly we'll take a look and ask at that. I think one of the reasons why we did that last spring was we were trying to make sure that we could make sure that we were staffed appropriately in long-term care facilities, particularly when we're with people that are exposed and they got to be quarantined. We know that can affect staffing levels, but I have a high degree of confidence that the people that are being hired are getting the right training. But something we should again, we're going to look at everything. I mean, when we're talking about lives, we got to examine can't make any assumptions. We got to examine everything. Jeremy, and then the next row next to Jacob.
Governor, we reported earlier this week that the Department of Health has been reporting misleading information that overrepresents hospital capacity. This is something that you touched on. The department was reporting the number of licensed beds rather than the number of staffed beds. Do you take responsibility for the publication of that misleading information, and if not, who is responsible for that?
Well, I mean, the buck stops here, Jeremy, for everything. So if there's information that's coming out from the state of North Dakota, but that you think is inaccurate, then it's got to be ultimately my responsibility, because the Department of Health reports to me. We have are digging hard into all of these numbers, and we're also digging into the new reporting requirements, because I know that the federal government has had some frustration as well, as they've been trying to nail down hospital capacity nationally, and they've put new reporting requirements on hospitals that receive federal dollars. So we're trying to, and you'll hear us talk about this next week, to try to sync up the federal reporting with the state reporting, with licensed beds versus staffed beds, versus people who were admitted with COVID versus somebody who might have come in for some other cause, and then when they were there, like getting a knee surgery, and then they give them a test and they're asymptomatic, but they're COVID too. Well, is that a COVID admission? No, that was an elective surgery admission. But so there's a lot of nuance in all those numbers. But I will take I'll take responsibility, but I'll also take I don't want to say I'll take a shot at a clarification around when you say the word misrepresentation, it makes it sound like that there was some artificial effort to overstate capacity or understate the issue, and I would take a challenge with that, because the effort has always been to be transparent around the availability of hospital capacity that we have. And when you think about last spring, when we were thinking about having to build surge capacity up to thousands and thousands of beds, then it is an accurate statement that capacity to date has not been a problem in the state of North Dakota. Could it be a problem? It could be a problem if we don't turn the numbers around. Yes, it could be, but right now it has not been a thing, and we're going to continue to be as transparent as we can while still protecting personal patient information. I want every mayor, every citizen, everybody who's considering getting an elective, anybody who's thinking about going into emergency, I want them to know what the capacity is, and they should be able to see it. Not have to wait a week for an announcement here. It should be on the updated website, and our goal is to have that out next week. Yes, please.
I'm Michelle Griffith with the Fargo Forum.
Hi, Michelle. Thanks for being here. Good to have you here.
I just have, can you clarify how the updated guidance for quarantining applies to schools? And does that mean if a school has a mask mandate, they will no longer have to, if someone is in a close, there will be longer quarantining if they have a mask mandate? And how
I want to make sure Kirby can hear this, because Kirby, you're going to be answering that question, so come on up here if you are going to be. Michelle, why don't you start over, and I'll let Kirby take over, because I think it's really about mask mandates for schools. Yeah. Okay. I'll switch with you, Kirby.
Yeah, I just had a question. Can you clarify how the updated guidance applies to schools in the school setting, especially if a school has a mask requirement?
Okay, so the question is regarding how the new guidance for quarantine applies to schools, and it does apply to schools. And so if students are masked, and all students are masked, when that one student who does become diagnosed, if they were masked all the while they're in school and they're in close contact with their schoolmates, then the others who were also masked would not have to be quarantined, okay? So those schools that have mask mandates, that's probably a good thing. I would say this, though, that we know that a mask mandate doesn't mean that everybody's wearing a mask. So the bottom line is that the important part is that people are wearing the mask. And we're talking about the cloth face covering, or we're talking about the type of mask that I'm wearing, a disposable mask. We're not talking about a face shield. We're talking, because the science that we understand is with the masks that we're wearing, like we're all wearing in this room, so.
Positive, will they, how is it tracked who is wearing a mask or not? Will the student have to remember around them who is wearing a mask?
So that's a good question, and how do we know if the student was wearing a mask? If a student tests positive, then our case investigators work with that family, and we talk about the different risk factors, and we'll talk about mask use, and we also work with the schools to make sure that that somebody at the school can verify that there was mask use, and that mask use was consistent and it was correct. And if we can verify those things, then we know that at least the source has been masked. Then the other question becomes, now we have to rely on the school to say yes, and everybody else was masked around them. And once we have that information, then we know that at least the contacts, instead of going into a quarantine, we could do an isolation, a self-assessment and a self-monitoring period. So.
There's about 140 folks that are currently quarantined connected to the high school in Williston, and that is a place where they require mask wearing. So if I were a student in a classroom and I was now quarantined, even though I have my mask on, am I going to be released from that quarantine?
So the question is will the policy or the new guidance be retroactive? And I think Governor Burgum already explained that it will be retroactive. So what's important, though, is that the mask use be correct and consistent. And so, yes, that's what we're looking for.
They would be released if they were both wearing masks.
Right. They both have to be wearing masks. That the person who was infected and those close contacts, they both have to be wearing masks. So if one party is not wearing a mask or both parties are not wearing a mask, then we have to go with the quarantine.
If they were both wearing masks, the nurse has to contact them and say you can return to school.
Theoretically, yes, that's right. That could happen. Yep. So.
Okay.
Scott Hennon, WZFG KFYR Radio. The flu death rate last year was about double the COVID death rate. Why aren't masks encouraged for the flu?
So I think that from our perspective, we have some good tools for influenza, and we've always practiced, or we always promoted a lot of the same things, for influenza as we do for COVID. Individuals who are sick should stay home. There's good respiratory etiquette. There's a vaccine for influenza that we really promote hard, because really vaccines are one of the best tools we have in public health, because they actually prevent the disease from happening, where a lot of the other things that we do for communicable diseases, we're reacting after an individual's already been infected. So I think there's a lot of good things that are a lot of common things that we're doing with these things. I think the good news is that if individuals in North Dakota do elect to wear a mask, and we want them to be wearing a mask, that it's actually going to reduce their risk for influenza. So.
I just had one clarification. I'm wondering, was there like a ubiquitous protocol for close contact quarantining at all schools, or was it up to the districts to decide when students had to quarantine after they were identified as close contacts?
So I think, the guidance that we put out is always been that if you're a case, you really need to be isolated, okay? So people who are infected will isolate. Anybody who was within 6 feet for 15 minutes total in a 24-hour period would be considered a close contact, and those individuals should be identified and quarantined. And so at the local public health level, these folks are doing an amazing job. When a case is diagnosed in a school, local public health would work with the school, say, this is the situation, who are the people that would have been close contacts, and we can identify those, and then information can go out to those families so that they are aware of who should be quarantined and what that quarantine period should look like.
Lane?
Governor, has the state thought about allowing universities and colleges across the state to release their total number of active cases? And I'm just wondering, because if so, then people could know how many are in their area and potentially avoid places around campus or places where college students like to frequent.
I don't know if that specifically has been discussed. I mean, there's discussions going every week about how can we attain more transparency without infringing on privacy. And of course, we do release the county data so people can go take a look at where our 11 universities are, where our 2 private universities are, and take a look at the case counts in those counties. But that's something that I'll ask a question again and see. But I don't know that we've been trying to think about doing it by university per se, because we've got students of all ages these days, and some of them are living on campus, some are living off campus, some of them drive an hour, some of them may not even be living in the same county. So it's unless Mike's got something to offer to that, or is they already putting it out somewhere?
What's that? Campus on the, oops, where'd it go? Yeah, I believe that's already available online.
Okay, so it's available. It's available to Mike Nowatzki anyway. But we'll see if it's available. We'll get it out there. Danny. NDUS is putting it out there. Okay, all right. So they've made a decision to do that. But on that, I'm going to maybe on that point, since we're talking about colleges, and sometimes when colleges we think about bars, I want to just offer something else, which is that when we talk about avoiding crowds, I think a better way to say that, if I was going to be really specific to the counties that are moving and have higher number of counts, is that it's indoors, it's crowded, if it's got bad circulation, if it's got noise where people are shouting and not talking, not wearing masks. I mean, what I may have just described is some bars in our state, but it also could be describing a wedding dance, a funeral, other things. And so I think, again, for people that are trying to avoid contracting or spreading this, then being able to be judicious about when you say avoiding a crowd. I mean, going to a retail situation with wide aisles and everybody's wearing masks, there may be a lot of people there, but you're really not in close contact. You're not unmasking, you're not talking, you're not shoulder to shoulder, if you will. And And there's, some evidence that the Japan in particular and some other places really focused on those kinds of crowded events and eliminating those, because those in some cases became super spreader events. We've talked about the R0, the rate of spread, is an average, but to get a rate of spread of one person each infecting one person, well, it turns out averages are always a combination of highs and lows, and there's increased thinking now that you may have 20% of the people doing 80% of the spread, and if that case is the 20% of the people who are doing 80% of the spread are the ones who were likely in a place where it was crowded, people weren't wearing masks, it was loud, people were talking, you were there for a sustained amount of period. So again, if you want to think about mitigation, again, avoid hosting or attending those kinds of things. It could be something that could really help us turn the corner more quickly than sort of the broad-based stuff. We've always said about being targeted, but we're going to continue to dig in to see if this 20-80 rule, if we can find more science behind that, and then go after what might be considered higher contagion or I hate to call them super spreader events, but they could be the place where one person infects a lot of people, and then you have another group of people who are infected, but as soon as they find out, they go home and they may infect nobody else during that time period. So we want to be focused on that. Danny?
Jean Shemp, Hometown Radio Group in Minot. If any community needs to increase the number of staffed beds available, what is the plan for making sure there's adequate staffing for those beds? Our local hospital has stated it's up to the state to ensure adequate staffing if COVID surge plans need to be implemented. Well,
I'd say it's going to be up to the partnership between the state and the health network, if you will, because we do have our tertiary, our large hospitals, where traditionally, if the person went into one of our local critical access care hospitals, we got, I think, 46 members in the North Dakota Hospital Association. If you went into one of those, that's typically a 25-bed hospital. If they had someone that had more acute illness, they would be transferred almost immediately to a Minot, a Fargo, a Bismarck, or Grand Forks. That leaves a lot of capacity in those other areas. It's very possible with the tools we have now to have some of those critical access care hospitals actually be acute facilities. It's also possible to take floors of hospitals that we have now and move them from non-COVID to COVID. It's possible for hospitals to ratchet back their elective surgery like they were doing last spring and create all kinds of capacity. So we have a lot of options, but we have to work in collaboration with the hospitals to do that. And the staffing part, again, is key, because we've got to make sure that we had identified before the pandemic even started, the State Workforce Council had identified nursing as the area where we had the biggest shortage in North Dakota. So things that we can do to cut red tape, to allow license transfers, some of the things we've done that allow, say, for example, if someone's got a nursing license in Minnesota, they can legally work in Minnesota immediately. We'll continue to look at red tape issues, but it's we will make sure that we've got adequate hospital capacity in North Dakota. Okay, Jack?
This is a follow-up to a couple of press conferences ago. You said we're in a state where a majority of people don't want to have a mask mandate. How do you know this? Have you done polling of people?
There is a combination of different sets of polls that have been done, and just the feedback that we get, which is vastly, the feedback that we're getting, that people get locally, they get from local public health, that we get at the health department hotline, that we get in our governor's office. I'd be surprised if anyone just living in North Dakota didn't understand that the feedback tilts towards more than 50% of the people in the state do not want to have a mask mandate.
But you wouldn't expect people who are in favor of a mask mandate to be as vocal, would you?
Some states, they're very vocal. I think it really depends on what states. Other states, the majority of the people do want mask mandates, and I think that it varies by different parts of our country, and I think that there has been a lot of polling done on mask mandates tied to political affiliation, and so there is a correlation there. And again, I'm sure you can find a lot of evidence online reliable sources that would support that assertion. But it doesn't really matter, because what matters is whether or not we have compliance, and we don't have a way to do any, there's no mechanism for kind of law enforcement of this. So what we really need to do is find every citizen to find their why, because we have states that have mask mandates that have record much higher % positive rate than we do, they've got mask mandates and they've got higher deaths, they've got higher spread, and then you've got states like ours that doesn't have one, and we've had even though with our horrible September, we've been among the lowest on fatality rate. We've got better than the surrounding states on positivity, and we've preserved hospital capacity. So again, North Dakotans have done a lot of things to get through that, and I think the key here is how do we get through in a state like ours where people have a deep sense of desire and pride and understanding about their own independence as North Dakotans. I mean, how do we tap into people's grace and compassion and understanding and sense of community? That's really the pathway forward. There is no path forward mandating something you can't enforce. I mean, that's just completely illogical. I mean, people keep asking us to do something that's unenforceable. Doesn't make any sense to me. What does make sense to me is having people get the information, be transparent, and then watch North Dakotans shine like they have in the past. Okay, I'm going to the back row, and then Jacob. And then I think we're nearing a wrapping up, unless Danny's got some. But
follow-up question to what Jack just asked. You're pointing to some of the differences between North Dakota and other parts of the country that have implemented mask mandates. Among states that have implemented them, I'm seeing West Virginia, Arkansas, Louisiana, Texas, all very conservative states. What about North Dakota specifically do you think sets it apart from some of these red-leaning states that have implemented mask mandates?
There's a number of things. I mean, I think that there's a cultural difference. I mean, you talked about, Appalachia to, some things that are considered more in the South. Some of those states have got really large metro areas that would be not considered politically conservative, but have got, a lot of people that are really demanding mask mandates. In some cases, like you referred to Texas, some of that's been done not on a statewide, but on a county level, where they've done different things with support of local officials. So every governor's got a different set of both challenges and opportunities, and I respect every governor making the decisions that they've made from both parties to try to navigate their way through this. So there's no one way through this. I mean, I would refer you to the Stanford study that came out a few weeks ago that basically said that mandates in different states have different results. Just because state A did it and they got this result doesn't mean if you did it in state B you'd get this result. I mean, do it in state B and people might actually have lower compliance instead of higher compliance. And so we're just trying to really focus on what works for North Dakota, and that's been really successful for us so far. It's why we've navigated this thing so well to date, and we're going to continue to stay focusing on things that work for North Dakotans. Jacob?
Governor, with these new guidelines, you say it'll create that incentive to wear a mask, but one of the points also being changed is to consider testing 7 to 10 days after the last exposure or whenever people start to become symptomatic. Do you worry with guidelines like this, you raise the incentive to wear a mask, but you lower the incentive for testing, considering what we know about asymptomatic cases?
I worry about that on a secondary level, because I think right now that where we are, the challenge that's in front of us right now is the mitigation that we know works, which is wearing masks when you can't socially distance. We've had disincentives to do that. Now we've got incentives for people to do it, whether it's families, communities, teams, businesses. There's a big incentive for everybody to mask up right now and keep everybody around them, going and in school and on the field or on the court. There's a big incentive to do it. I think we're going to see a change in behavior, and if we got more masks, we're going to need to do less testing, because we're going to have, we're going to have less cases, and we're going to have less for our contact tracers to have to do. Our contact tracers are going to have less close contacts they have to follow up with. As soon as we have lower cases, it reduces their workload. So I do believe that that people, when they're symptomatic, are probably very good about getting tested. I think on asymptomatic testing, we're going to continue, like with college students and others, continue our program to try to do surveillance testing just to make sure we can catch it before it gets to the point where it's more broadly spread. Surveillance testing will remain a key part of what we're doing for months and months to come. I'm sure even after we got a vaccine out, we're going to be wanting to do the monitoring to say, hey, is this thing coming back? As we've seen in our state, we had 5 months of really low percent positivity, and then we've seen in the last 6 weeks this thing can get going in a hurry, and so we have to respect that it is that this is got a rate of an infection rate, and it's contagious enough that it can spread pretty quickly, and that we should remain vigilant. And one way to do that is with smart surveillance testing. Okay, Danny, and then I think we're done.
Matt Henson, WDAY, regarding hospitalizations, are there talks again to open up field hospitals similar to the one they had staged in the Fargo Dome?
The surge plan that we had last spring never went on the shelf. It's always been at hand if we need it. But I remain confident that we are not going to need to do that. I mean, we've got just over 100 COVID beds. Even conservatively, when you're looking at staffed, we're talking about thousands of beds in North Dakota. So we're really still talking about, no matter how you slice it, we're talking less than 10% of the beds related to COVID. And there is, as we demonstrated last spring, people were able to shift demand and free up space for COVID. And so I remain confident that we're going to be able to manage our way through that with the great providers that we have, and not have to and not have anybody receiving care outside of an existing hospital facility. Okay, with that, we'll say thank you, and next week, Thursday, 8 o'clock, we're moving to the morning again due to other scheduled conflicts. Of course, the Main Street Initiative on Tuesday and Wednesday. Thursday, October 8th at 11 a.m. is when we'll be here the next briefing. Thank you all for being here. Appreciate it.